and welcome to the Chamber of Medford-Jackson County's virtual forum. This webinar is sponsored by Regions Blue Cross Blue Shield and is brought to you by our season sponsor, the Cow Creek Band of Umpqua Tribe of Indians. I'm Scott Kelly. I'm President and CEO of Asante, and I will be emceeing today's program, featuring our speakers, Angela Dowling, President and Regions Blue Cross Blue Shield of Oregon, Dr. Jim Polo, Executive Medical Director for Regions Blue Cross Blue Shield of Oregon, and Dr. Jamie Grabowski, Senior Vice President and Chief Medical Officer at Asante. Also with us today, we have Brad Hicks, President and CEO at the Chamber of Medford and Jackson County, who will be moderating questions from the audience and our panel at the close of the program. Thank you all for being here. I would also like to thank all the forum sponsors who help us put on these programs. Thank you for your participation as we continue to hold these events virtually. Without your support, the Chamber wouldn't be able to bring everyone together for timely topics that are important to our business community. Now, just as we do every virtual forum, I would like to remind you of how today's program will work. If you've attended one of these online forums before, you likely already know this information, but those of you who are new, I'd like to explain a few things for our viewers. As you've noticed, you are not on screen and do not have video or microphone capabilities. You are currently an attendee. There is a Q&A feature of this webinar. Please find it at the bottom of your screen, an icon with a Q&A on it. Here you'll be able to type in your questions for our panelists. Brad will be reading through the questions and asking a few at the end of today's presentation. So with that, I would like to now introduce today's speakers. Angela Dowling. Over the course of her career, Angela Dowling has designated and implemented creative solutions that align business strategies with consumers' health needs. As Chief Revenue Officer, Angela drives revenue strategies across brands, products, and markets by bringing greater integration and accountability in directing the organization to create a better healthcare experience. Angela's leadership has helped position Regions as a trusted advisor to many of Oregon's most respected companies at a time when sound strategic healthcare decisions are more critical than ever. In a role as Oregon Market President, Angela directs and guides the overall performance of the Oregon Health Plan, including sales, provider contracting, government affairs, and community relations. Dr. Jamie Grabowski. Dr. Jamie Grabowski obtained his master's degree in healthcare management from the Harvard School of Public Health in 2007. He joined Asante in 2012 and impacted the organization through his multiple roles. His Asante career began as Vice President of Medical Affairs for Asante Rogue Regional Medical Center and Asante Ashland Community Hospital. In 2006, he became a Chief Officer for the system, first as a Chief Quality and Patient Safety Officer, and currently as a Senior Vice President and Chief Medical Officer. Before his time at Asante, Dr. Grabowski practiced as a family medicine physician in various physician leadership roles across the world, such as Virginia, New Mexico, and internationally in New Zealand. Dr. Grabowski's passion for medicine is derived from his desire to see patients receive the best possible care. Last but certainly not least, Dr. Jim Polo. Dr. Jim Polo is an Executive Medical Director at Regions Blue Cross Blue Shield of Oregon. He previously served as the Executive Medical Director for Behavioral Health for the Regions Health Plans, developing and overseeing a comprehensive behavioral health and substance abuse strategy in alignment with community partners to deliver a more integrated, high-quality care. Dr. Polo brings more than 25 years of experience as a practicing physician, as well as an executive leadership position for hospitals, physician groups that specialize in medical, surgical, and pediatric services. Dr. Polo has served as a policy advisor to the Secretary of the Army at the Pentagon and worked as a consultant on healthcare reform in the private sector. He attended college at West Point in New York and received his medical degree from the Uniformed Services University of Health Sciences in Maryland. He holds a master's degree in business administration from the University of Colorado. Thank you again for being here today. And Angela, I'm now going to pass the mic to you to get started on today's presentation.
Great, thanks, Scott. Good afternoon, everybody. You know, in preparation for today's conversation, I was thinking about this last night and realized that we were in person a year ago when we were talking about healthcare. Scott and I were up on the podium, and a few weeks later, we really moved into a lockdown position in terms of how COVID has impacted us. It's pretty astounding when you think about that so much has happened over that year. In fact, that's a lot of what I'm going to talk about right now is just a few data points around what we've seen, what COVID has done to our economy, to our social fabric, and then I'll turn it over to the clinicians right away because I know that they are really who you want to hear from, and so I want to make room for that. So why don't we move forward in the slide deck? This is just an overview of kind of the impact that COVID has had on our state and as on our country. I won't go through all of the details, but it gives you a pretty eye-opening view of the impact that COVID has had. So at the upper right-hand corner, you'll see the GDP percentage change over time. And you'll see that when COVID hit, we had a dramatic pullback in the close to 35% of a pullback in our GDP, and then a rebounding of that after that quarter. And we're starting to continue to see that GDP is expanding slowly over time, which then impacts at the bottom the unemployment forecast. We do foresee that at one point unemployment in the state was 13–14%. That's where you see that dramatic shift in that curve, but then we're going to see a long pullout from that. In other words, it's going to take a little bit of time for us to get back to pre-pandemic days where unemployment was in the low single digits. And it also is impacting going back to school. It's impacting how employers are working with their employees and actually pivoting business models. I've talked to many employers who are actually just completely pivoting their business. I talked to a food manufacturer who said that they were focused on convenience foods for a long time. And now they've pivoted to actually foods being made in home because people are changing their behaviors. And so it's interesting how COVID has had this impact. And it's what I call kind of the triple trifecta. You've got an economic impact, we've had a health impact with COVID, and we've also had quite a bit of social unrest as well. And I'll talk to that in just a minute. So let's move forward in the slide deck. This is how Regence has responded to some of these challenges. First off, we've provided over 110 million in COVID-19 tests and treatments, 110 million. And so we've seen a lot of people getting the test, first and second time testers, people just making sure that they are taking care of themselves. And then it is also for us now paying for the vaccines as well, or the administration of the vaccines. There's also some financial support that we've provided to our provider systems. We realize that this is creating additional challenges for providers simply because they can't do some of the voluntary services or services that people could hold on to for a little while and are really focused on the pandemic and servicing those needs. And so we've had to provide some assistance and support in terms of claims payments, as well as working through pre-authorizations and so forth, and we've done that. We've also contributed over 18 million to philanthropic investments and also over 11 million in premium refunds. And so in September, if you were fully insured, you were able to get some of that refund because people were holding off on getting some services and there was this delay in terms of claims payment. All of that in an effort to help providers, help our members, and help our communities withstand some of the challenges of COVID. Let's move on. I mentioned earlier social unrest. We also know that we have to address social determinants of health. We understand also, and Dr. Polo may talk about this later, that people of color are actually being impacted by COVID more than some other populations. So how do we address that? How do we work with those communities serving those individuals? And you can see here just an overview of the work that we've done within our communities, where we've supported over 1,000 diverse Oregon organizations to help provide services made tremendous investments in our community, and 250,000 in wildfire relief, which is very important in your areas because your community was impacted the greatest. And then also Health Equity Task Force, where we realize that we have to be very thoughtful about how we're serving our members and making sure that we're serving all of our members in an equitable way. And moving forward in the slide deck, in the last minute, I kind of pulled this slide forward. This was simply on the left. This is actually when we were together recently, well, about a year ago, and you can see us all in this room. And today on the right is how we live today in this virtual environment. And what a transition that is made when you think about how we interact with one another, how we share information, and now communicate. Just a tremendous change. And employers are doing this as well. Many of them, we would do open enrollment meetings face to face. Now today we realize we can't do that. We don't want to spread the disease, and therefore virtual environment is the way we go. So with that, to continue the virtual environment, I'm going to turn it over to Dr. Grabowski, and he's going to talk about how Asante has responded to COVID-19.
Thank you very much. I really appreciate that, Angela. I'd like to go through a few things about Asante's COVID-19 response. And it strikes me that Angela mentioned a year ago, we were meeting in person, and now we're meeting virtually. It's been just a year ago in this country that we have had our first mortality around COVID, and it was a year ago this month that we as a healthcare system pulled up our incident command team, which is our way to respond to the COVID vaccine. And what I'd like to do today is tell you a little bit about our response in the last year and how that's looked. Slide, please. Well, the first thing I want to do is make sure everybody understands who Asante is. We're a regional healthcare provider here in Jackson and Josephine counties. We service the outlying counties as well. And really, we've differentiated ourselves in the market on the basis of quality and safety. This is just a few of the accolades we've received. I just want to spend a second talking about one, the CMS 5 stars. CMS is the Centers for Medicare and Medicaid Services. And what CMS does, they look at a range of quality and safety metrics, looking at cost, throughput, efficiency, patient safety, patient experience, mortality, readmissions. And essentially they put all hospitals in the country on a bell curve, and they create cut points, and they use those cut points to create stars. And I'm very pleased to say that 5 stars puts you in the top 5 to 7% of hospitals in the nation. And we have been 5 stars. All our facilities have been 5 stars. And CMS just last week updated its star rating for facilities, and all our facilities continue to be 5 stars. Next slide, please. Well, we've translated that focus on quality and safety into the pandemic and our response for the pandemic. This is a shot of our mobile collection site. We were the first mobile collection site in the state. We had seen that one was pulled up elsewhere in the country, and got on the phone with that site and said, how are you guys doing this? What does this look like? And decided to pull one up so that in early March, we had the state's first mobile collection site up and running. And we quickly on the heels of that got testing up and running, utilizing up to 6 platforms for local testing that's highly reliable and effective. Next slide, please. Well, you can see one of the other things we did very quickly, if you look there, this is March of 20. One of the things we recognized very quickly was that local physicians' offices were getting swamped with telephone calls. So one of our responses was to pull up a community COVID hotline. And you can see the very interesting shape here. We're at the beginning. That COVID hotline was very, very busy. Over 600 calls there a day into the hotline, and over 400 calls to the triage line, so over 1,000 calls. That sort of slowed down over the summertime, and you can see that that is heating up now. as people are interested in receiving the vaccine and having questions about vaccination. Next slide. Angela mentioned, as part of the Blue Cross Blue Shield support and Regence's support for transformation of care, is telemedicine visits. And here you can see what our curve looks like at Asante, from essentially just a handful prior to the pandemic to, in April, over 12,000 visits, really stabilizing at between 8 and 10,000. I think this will be one of the transformational changes that we'll see. Angela showed you a picture from before we were in person doing this, and now we're doing it virtually. I believe there will be a role for care delivered virtually after the pandemic, and this is something that I think will be a lasting impact on our community and the way we deliver care. Next slide, please. Another thing we've taken the lead in is infusion with mAbs. You may have heard about the medication that President Trump received when he was very early in his course of COVID-19. That's what these medications are. One of them is Regeneron, and there are other medications that are approved by the FDA for emergency use. This is a very helpful medication that you give in patients who are very early in their COVID disease course that do not yet require hospitalization. And the hope is, and the evidence is strongly suggestive, that you reduce severity of symptoms, you reduce viral shedding, you prevent emergency room visits, you prevent hospitalizations in those patients. And certainly the big places across the country, Cleveland Clinic, Mayo, and their data support an effective use of infusions. Locally, we've pulled this up at Ashland Hospital. We've got a separate entrance and a safe way to deliver this medication to patients. Next slide, please. Well, one of the big success stories of the pandemic has been Operation Warp Speed. Everybody in the room knows about that. It didn't come out of the blue. It came out of decades of research on messenger RNA. We've been working with messenger RNA since the 70s, and we had worked on vaccines for very similar kinds of organisms. SARS-CoV-1 and MERS are very similar coronavirus organisms for which we had developed vaccines in the late 2000s and early 2010s. And we put that experience to use to really pretty amazingly develop this vaccine in under a year. We've had some logistical problems, next slide please, in really distributing the vaccination. And Oregon was no exception to that rule. Oregon on January 4th was 48th in the country in our ability to roll out the vaccination. On that day, Oregon Health Authority sat down with a group of CMOs like myself and others in the state and asked for healthcare systems to help and expand what they had set up for their employees into the greater population. And so for the last month, as many folks know, we have been working very hard to make sure that we expanded our capability to make sure that we vaccinate the population. You can see here is a mock-up of our vaccination clinic. We've done that in a modular fashion. As we set this up, again, we reached out to other facilities to borrow what was best in those facilities. And one of the things we found worked best was modularization of this, so we could just plop in different units, and we can scale this up to 4 different units so we can get over 1,000 immunizations a day for folks in our clinic. Next slide, please. And so one of the things that we did was help work with public health, with federally qualified health care systems, with the National Guard, and with Providence, and with others to help pull up a drive-through mass vaccination event, a mass vax event. And you can see in that event here in Jackson, we did over 7,200 immunizations at that time. And it really took a team effort of pulling together all those groups and volunteers in the community. Anybody on the call who volunteered, we greatly appreciate your help. And that was an amazing event. You can see in our clinic that I showed you on the previous slide, we've immunized almost 12,000 people, and other sites in Jackson County, including some of those partners I mentioned that were helping with the mass vaccination event, and as well as pharmacists and long-term care facilities and others have immunized over 6,000 folks. I do believe the way to move forward and what we're advocating to the state is continued large-scale immunization events. You can see from the numbers that seems to be the way to go, where you can get 1,000 vaccinations into our site or more a day. You can get several thousand a day in the mass vaccination events. That seems to be a way to get more shots in arms. Next slide, please. This is Josephine County, the Josephine County event, mass vaccination event, again, partnership with those groups. Over 3,000 shots, and a clinic that we pulled up there, over 600, and other immunizations in Josephine County as well. Next slide, please. Many of you may have seen this story. It's really important. Dr. Candelaria, he's a hospitalist at one of our facilities and is also functioning as a public health medical director for Josephine County. Really used good judgment in an area where they might have not been able to use vaccines, so they just went up and down the road and vaccinated patients. I'm a big believer in more vaccines in arms is best for our population, and anything we can do to do that helps blunt the curve that we're dealing with right now. Next slide, please. To that end, one of the things that we're doing is engaging actively in what's called a hesitancy campaign. So that's for folks who really aren't sure, have questions about, does this vaccine really work? Is it helpful? Aren't I just better off getting COVID? And so this is a campaign that we're starting internally and externally to help people understand the value of receiving a vaccine, not only for themselves in preventing serious preventable illness, but also for others in protecting them and helping getting back to normal as much as possible. Next slide, please. Well, I really don't know what the future will bring. This vaccine has humbled us all. I think this pandemic has humbled us all. I really think the best path forward for us is to continue with our efforts that we've engaged in mask wearing, physically distancing, and engaged in large, broad scale vaccination efforts. And anything we can do to get vaccine off the shelves and into people's arms as quickly as possible, are the kinds of things I think we need to be doing to help change the trajectory of this pandemic. And with that, rather than taking questions, I'll turn it over to Dr. Polo.
Great. I should have, hopefully I should have good audio at this point. So let's jump to the next slide. I'm going to keep my comments relatively brief so that we can get into some questions. And I want to first talk just a little bit about what we're seeing at a higher level. First of all, in terms of just modernizing our delivery system. The pandemic has actually created many challenges, but at the same time, we've taken advantages of many opportunities. One of the things that happened very early in the pandemic is that we were constantly telling community and telling patients and members, hey, before you just go in to be seen for anything, either at the emergency room or your doctor or your urgent care, call first. And you'll notice that, as was just mentioned, there were tons of phone calls coming in at Asante. And so the thing that's been helpful in this regard is that the value and the importance of having a primary care provider has been re-solidified as something that's important as part of how we make sure that folks are managed through their healthcare journey. We know that when folks have a primary care doctor, they're more likely to follow their doctor's advice. They're more likely to get their preventive care services met. They're less likely to utilize those expensive parts of the healthcare system, and they're more likely to be productive at work. So the pandemic has kind of reinforced this idea that people need to have a primary care doctor that they can call and rapidly connect to get advice on what to do, where to go, where not to go. Early on, of course, not to go to the emergency room. The second thing that really has occurred from a system-based perspective is this move into telehealth care. Now, we were already moving towards telehealth care before the pandemic, and what the pandemic has really done is it's increased the speed of getting there. At Regence, in the first few months, we noticed a 4,000% increase of use of telehealth services over on-site services. And I'll highlight that this is for all types of care, not just behavioral health care. You know, obviously we had been talking about telehealth long before the pandemic in terms of utilizing that for behavioral health care. But as it turns out, many of our medical specialties are able to provide high quality care in a telephonic video interface with their patients with no real decrement overall to the outcomes of whatever they're getting treated for. So this has been a significant move forward, which is actually going to do a number of things. First of all, in the long run, this is likely to create a delivery system that is more tailored to what patients want and need. It's likely to be more convenient to be able to get care whenever you need it from wherever you are, at the same time that it's likely to be far more cost effective in the long run. And then finally, the other modernization that really has been ramped up is use of technology. So technology has really been delivering on devices, first of all, that allow folks to monitor medical data that is fed directly to their healthcare providers so that their care is really continuous rather than being episodic, as well as technology in the movement of applications. Computer applications that allow for either virtual or mobile care. Next slide. Want to touch a little bit on behavioral health. This has been a focus in the media. Clearly, we are struggling through what's a natural disaster. We've been in this natural disaster for almost 11 months now. We're finally probably at the point where we're starting our recovery phase. But early in this pandemic, lots of folks struggling with tremendous amounts of uncertainty that created stress and anxiety. Studies showed that 40% of all American adults by June were experiencing what they referred to as some kind of an emotional challenge in relationship to the pandemic. Now, that increase of stress and anxiety has obviously created an increase of demand. That demand has put a strain on many of our networks. We were having difficulties with behavioral health access prior to the pandemic, and the increased demand has made those services even more sometimes difficult to get. So because of that, there's been a tremendous amount of movement in the creation of virtual self-driven mobile applications in mental health. These are applications that individuals can utilize on their own without the necessity of having a provider at the other end to basically address those mild and moderate type symptoms that folks are having. Keep in mind that when you have a disaster like this one, like any disaster, the overwhelming grand majority of folks that suffer from stress and anxiety will adapt and they will thrive. So the other thing that has come out of this pandemic is a sense of normalization that stresses is really just a part of life, and that having a behavioral health challenge is not a deficit, but rather it's just something that you need to kind of address. And so in some ways, stigma is being chipped away at as we all kind of suffer through this together. You're likely to see an increase of demand of behavioral health services for quite some time, as the behavioral health challenges are likely to be longer lasting than the actual medical impact of the pandemic. Let's jump to the next slide. I want to address a couple of reasons why I think there's still optimism looking forward, because You've been hearing a lot in the media about all the negative things about the pandemic and how challenging it has been. And there's no question that it's been challenging, but there are really some good things on the horizon. First of all, as was already mentioned by Dr. Grabowski, we've got vaccines out there and we're finally starting to ramp up. So far in the United States, roughly 10% of the population has already been vaccinated. That doesn't sound like a lot, but actually it is. It's over 30 million. Keep in mind that this is the first time in our history that we are embarking on a national vaccine program for literally the entire population. Annually with the flu vaccine, we rarely go over about a 48–50% vaccination rate. And chances are we're going to exceed that by summertime with COVID. Two of the vaccines, as was mentioned by Dr. Grabowski, that are currently out use messenger RNA. This is not new. We have a third vaccine that's probably going to be coming out very shortly, the Johnson & Johnson vaccine, which is a one-time vaccine. Now, you will hear in the media that the Johnson & Johnson vaccine is only 72% effective compared to the other two, which are about 95% effective. Keep in mind that the flu vaccine in the last 10 years has fluctuated between about 19 to 60% effectiveness. So the three vaccines that are about to all be available to the American population actually have very good effectiveness to be able to bring some control to the pandemic. Now, during these past 11 months, we have had to work together as a state. And when I say work together, I mean our departments of health, our providers, our provider systems, our networks, our hospitals, the payers. We have done a tremendous job in Oregon of really managing our hospital capacity and ensuring that ERs were available to see patients when they were in need. Oregon is one of the states that actually has a very low number of beds per capita, and we have not really had any significant challenges that put any of our communities at risk. So bringing everybody to work together has been another positive impact that is now setting the stage on how we begin to take care of each other as a community moving forward. Now, as Angela mentioned early, we've been very sensitive as a state, particularly as it relates to the pandemic, to making sure that we don't miss those communities of color or those communities of individuals that are disadvantaged. The state has a high priority in ensuring that these folks are not forgotten when it comes to ensuring that everybody has equal access to vaccination. And so as a state, we're really moving forward very well right now in basically taking care of the community at large. And then finally, I think the other thing that really brings me a lot of optimism is what I've been able to observe in so many ways is a lot more engagement in healthcare by individuals themselves, patients, by employers that are truly interested in taking care of their employees, by community chambers that are thinking about what's good for the community, keeping in mind that when we all think in terms of wellness, more than likely, we're likely to do better, feel better, and really kind of enjoy our wellness as opposed to focusing on being ill and sick. So I think there's a lot to be looking forward to. Currently, we've noticed that most of the other areas of healthcare that were initially put on hold are really back up, very close near to the levels of before the pandemic. So routine care is occurring, preventive care is occurring. Once we get fully through the initial phases of getting the grand majority of the population vaccinated, I think we will begin to see a lot more of that returning to normal. But one final comment I'll make, I have to emphasize this, I always do. It's important that we continue to wear masks, we continue to watch our distance, and we continue to wash our hands and practice a good, clean hygiene. So I'm going to stop here so that there's plenty of time for questions and turn it back over.
Okay, well, during dress rehearsal, we assumed there'd be a lot of questions, and we were right. So right out of the chute, we have a question for Jamie, and this is from Bailey Lavoie, who also says she misses you and the gang at the gym. I think that's okay to mention here. But her question is this: can you please talk more about the hesitancy campaign and how businesses might be able to share some of that information with their employees?
Of course. Well, I also miss going to the gym and all the things I used to do a year ago. So there's a lot of things that we're not doing. And really, the hesitancy campaign is about getting back to normal, right? Everybody wants to get back to doing those sorts of things that we were used to doing, and this is really an effort to do that. And so it's an effort to work with people where they are and sort of get around some of the misinformation and mistrust of the vaccine, because what's clear is the more people that get vaccinated, the less likely we are to have mutants pop up and create more trouble for us over years. And so it's really important to do that. So I think we're going to work externally. I'll work with Scott and our marketing team to say, hey, how can we share this and share components of this with the community? I think it's a really good idea because it really is a community-based effort. If we get 80 to 90% of the population immunized, we'll be in a much better place than we are if only 50% of the population gets immunized. Because remember, if only 50% get immunized, that means 50%, there's a reservoir of vaccine. And essentially, if you don't get immunized, you're getting COVID. You are getting COVID in some way, shape, or form. And it will just create more variants and more challenges for us to sort of control this in the long run, because COVID's going to be in the population for the long run. And so we're really talking about controlling a chronic disease here over years. And the way we're going to do that is through vaccination campaigns. So I think that's a great idea. I'll look to Scott and our marketing team, and we can work with the chamber on sort of getting that out and making that available to folks, I think.
Thank you. Happy to help distribute information there as well. The next questions are really, they kind of fall in the all-comers category. So I'll let the panelists decide which one of you want to take a stab at these. But starting with this first one, and I hope the answer is yes. It's a two-part question. First part, will I have a choice in which vaccine I can get? And I hope the answer is yes. I've been saying to people, I'm holding out for the Johnson & Johnson version, not because it's a one-shot version, but because I understand they're using their patented no tears formula in that one. So I'm looking forward to that. And then which vaccine is best if we know that?
Tell you what, I'll take a stab at that because I've had this question in other venues. First of all, the first thing I would say is keep in mind that these vaccines are being developed for the global population, not just for the American population. The Johnson & Johnson already has 1 billion vaccines on order. 800 million of those are actually going outside of the United States. They're not coming to the United States. Early on, it's not likely that you will have a choice. When provider systems that are given vaccine, they are usually given one or the other. They're not currently being given both. So when a vaccine event has been scheduled, more than likely that is going to be all of one vaccine given to whoever the people that are attending at that event. Now, later on, when we're past the acute phase, is it possible that folks might get the option of one versus another? And will we have more science that indicates that certain populations should get more of one over another? That might be the case. What I would recommend is that if you are offered a vaccine of any of the ones, take it. Do not wait for a different vaccine. Take the one that's offered, because the quicker we can get more folks vaccinated, the quicker we can get control of the pandemic.
Thank you for that. Again, for our entire panel, are masks recommended? And I think we may know the answer to this, but are masks recommended even after receiving the vaccine?
So this is Jamie. I'll take a stab at that. So first of all, just a general comment about masks. So 2 years ago, I did an extensive literature search on masking because it came up around the flu vaccination and we were going to implement masking. We did implement masking if as employee you didn't get it. And there was a little bit of literature out there. It wasn't great that showed masking prevented influenza. Well, in the last year, there's been more literature done on masking than pretty much anything else out there. I mean, we have a ton of literature that says masking is helpful. Now, to answer the question directly, yes, you likely will have to wear masking. The reason is because we don't know if you get vaccinated, can you still spread the virus? To what degree? If you become infected, to what degree do you shed virus? So we don't know those answers at this point in time. So it looks like masking is going to be around for quite some time here.
Thank you. Another question just popped up, and because I don't know if people want to or don't want to be identified, I won't from here on out. But this question is, I'm hearing about side effects for vaccines, especially with children. One main concern is on male and female reproductive health. Any thoughts or comments about that?
So I'll mention this because I've received this in other venues as well too. There is currently no evidence to suggest that the vaccine for COVID will in any way affect fertility for either men or women. And to be honest, we haven't found that to be the case for any vaccines that we currently provide in our country. Keep in mind that the symptoms that folks are experiencing from vaccination are generally those acute, very short-lived symptoms, maybe a little bit of chills, maybe a little bit of fever, maybe a little bit of tenderness. And those are the symptoms that basically let you know your immune system is gearing up. You're beginning to recognize the antigen so that you can begin to create the antibody that's going to fight off potential infection.
Yeah, so just an additional comment there. I agreed with everything that Dr. Polo said. Remember, these vaccines, the Pfizer and Moderna, are not indicated for children. I believe the Pfizer is 18 and the Moderna, or no, the Pfizer is 16 and above and the Moderna is 18 and above, because they just simply haven't been studied in those age groups at this point in time. Like they haven't been, there's a few segments, pregnant and lactating women, they have not been studied in extensively either.
Okay. Next question, how does the flu shot and a COVID vaccine intersect? Can someone be vaccinated for both at the same time?
Dr. Grabowski, I'll let you take this one. You probably know a lot more about this as a family doc.
Yeah, the answer is yes, but I probably wouldn't recommend that. Remember, you should be healthy when you get the vaccine. You want to have the maximum immune response. Remember, the vaccine, the reason why you get a vaccine is it's essentially teaching your body to recognize and fight this virus. So the messenger mRNA helps recognize something called the spike protein on the virus, and it basically teaches your body. The more things you have going on at the same time, it may tend to blunt that response. So I probably wouldn't recommend that at this point in time, that you're getting concurrent vaccinations.
Thank you. Good question and good information. Next question. Are you seeing barriers to access as it relates to telehealth services in certain populations? For example, people who do not have computer or internet access at home. What opportunities for community organizations or local businesses might there be to help address any gaps?
Well, this is Jamie, and folks at Regions may have a response to, but absolutely we're seeing that. Particularly some of our populations in Josephine and Curry and Douglas and Northern California, more remote areas, folks with social determinants of health and poverty, that they really are struggling to access services via telehealth. So whatever spaces there are there to help patients have access to telehealth services are really helpful. some of the things we've done is we've allowed patients to come on in, drive into the parking lot, and provided them with a tablet. So now they have service, now they have a tablet, and they can access care. So we've done that, but I think there's a lot more that can be done and that should be done to extend access for telehealth services.
Yeah,
Great question.
let me add on to that. At Regence, we also have noticed that there are challenges in certain communities. In fact, this year we donated several $1 million for the purposes of mental health and behavioral health in our rural communities throughout the state, where the challenge of accessing services is significant. You know, Jamie mentioned the fact that there are folks that don't actually have the hardware, or they don't necessarily know how to use the hardware, which certainly can be one barrier. The other one is that keep in mind that even though telehealth is convenient and it allows you to treat folks at a very large distance, it actually does not increase your capacity. It doesn't create more providers out of the numbers that we have. So there's still a set capacity load on the system, and we have to be thoughtful about how we make sure that if we start using telehealth services, that we still make sure that it's equally kind of accessible in a way that doesn't sacrifice certain parts of the community. So very challenging arena where we have to work together and think about how do we make sure that we're allowing equal access to all members of the community for their healthcare.
Thank you. And my compliments to the panel for leaving this time for Q&A. We're getting a good number and really good questions and answers. So I appreciate that. Okay, so next question. Well, I'm going to start here. I'm going to go back to a previous question I missed. I'm sorry. Do we know when children will be allowed or encouraged to be vaccinated?
This is Jamie. That's a really good question, and I don't have the answer to that right now. I think those studies are going on now. I think people are going to be taking a look at that. But my guess is we're going to be working on vaccinating the adult population where we have good safety and efficacy data and do that. I just want to take the opportunity. I neglected to say the rest of the story. I said before January 4th, Oregon was 49th on the list of states in terms of getting the vaccine in arms. And since that request to healthcare systems, we've varied between 13th and 16th in terms of states doing that. So the healthcare systems have really dramatically altered the trajectory of immunizations in the state of Oregon here.
Great, thank you. Also, my appreciation to the panelists. I see we've got some folks on the panel answering direct questions in the chat, so that's really helpful, and I appreciate it. Takes the middleman out of the equation. Because
Brad, just a clarification. I see the one in the chat about timing. Just a clarification on that. It really hasn't been studied so well about, but we do feel it's safe up to 42 days. So there's been some information about that. So 42 days is sort of the limit. And we feel like we should be able to get second doses into folks who have had their first dose up to 42 days. That's 6 weeks. So.
Gotcha. This is not a question from the audience, but just as a follow-up to that, what if availability became the issue, not willingness, and someone fell outside, that second shot fell outside of that 42-day window? What do you have any recommendations there, or is it sort of unknown territory?
My best recommendation would be get it as soon as possible. Then it is likely that you'll have a vigorous response and it'll be helpful. Can I say that with a surety? No, but it is very likely, given what we know about vaccines, that you'll be just fine.
Okay, thank you. Because we have, the majority of our audience happens to be employers. What can employers do to encourage employee vaccination?
Go ahead, Jamie.
Go ahead, Jim.
No, I was going to say, I meet with a lot of employers, and this issue actually comes up in more than just vaccination. And what I usually will encourage employers is, first of all, lead by example. So folks are going to feel more comfortable if they see that their leadership is asking them to do something that they themselves are doing as well, and that they're leading by example. The other important thing for employers is to make information available, and also to be flexible to allow folks whatever leeway they need, so that if they're a shift worker, allowing for them to be able to get off to get a vaccination is going to be very important. Keeping in mind that many employees come from families that have multi-generations within them. And so it's about worrying about that entire family and how to assist them as a way of making sure that the employee feels cared for by the employers. But employers really have a lot to gain by encouraging their employees to take care of their own health.
And at Regents,
And this is Jamie.
now, I'm sorry, Jamie.
Go ahead, Angela.
I was going to say, we're in the process of developing some communication materials to help send out to your employees to encourage and explain why it's important to get the immunization. Some of it is awareness, some of it is just encouragement, and employees look to their employer as a trusted source. So as Jim said, if you as a leader of the organization are supporting it and you yourself are in support of it, they tend to follow and will match that behavior as well. So you will see that in some of our future communications. Jamie?
And this is Jamie. Some healthcare organizations and others and health plans are using very targeted financial incentives. We know that targeted financial incentives can work for crisp, short-term behavioral change, like getting an immunization. And so, we at Asante are giving consideration to doing that, and that could be helpful as well.
Great. Thank you. Jim, did you have something you wanted to add to that?
No, I think it's been covered. Thanks.
Okay, good. There's probably a lot to unpack on this one, but let's give it a shot. Now we're starting to shift focus away from the COVID-19 virus we knew, and starting to think about mutations of that. So please touch on the mutations and how the vaccines are being developed or modified on the fly to address that.
So let me address that one up front, and then I'll let Jamie jump in. He might have some additional information. First of all, most viruses mutate. It's a mistake during their replication process. And of course, the more a virus mutates, the more challenging it is because there can come a point at which the variants are resistant, or they're just not impacted by vaccination. COVID actually is mutating at a much slower rate right now, about 4 times slower than the flu. So it's still not a guarantee whether or not we will or won't need an annual vaccination for COVID, even though that's been talked about. There's still not a kind of a clear pathway forward on that, which is why we're trying to encourage so many folks to get vaccinated. Now, the variants that are coming out, the one that appears to be the one that's spreading the most quickly is the UK variant from Britain, which is in 36 states as of today. That variant appears to be equally impacted by vaccination with both the Pfizer and the Moderna vaccine, versus the variant from South Africa, which appears to be a little bit more transmissible, is potentially a little bit stronger. And in fact, it just was announced earlier that the AstraZeneca vaccine, which is not available in the US yet, doesn't appear to be very effective against the South African variant. Keep in mind that the studies that were done early were based on the virus as we understood it then. And some of the mutated variations are coming out after those studies were completed. As more and more knowledge is gained, more than likely the pharmaceuticals, and I already know they're working on this, will develop probably additional refined potential boosters to capture the ability to address some of the newer mutations. But this is not unusual when you think about the way viruses normally spread and how we develop vaccines against them.
Thank you.
That's true. And in the infusion clinic, one of the MAB medicines seems to be less effective against the South African variant as well. So anything we can do, so that's why I'm saying shots in arms is important, because that gives the virus less of an opportunity to mutate and to evade our current vaccine. Likely what will happen is we'll need to develop vaccines that have changed a little bit to whatever the more common strain is. If the UK strain becomes dominant in the US, we may, depending on the effectiveness, we may need to develop sort of a booster shot, if you will, here. So all remains to be seen.
Thank you. Well, we're going to run out of time, so I'm going to ask one more question. My apologies. I'm just doing it in order, so my apologies to any questions that we might not get to. And let me again say thank you to the audience. I think we've had great participation and great questions. This last question is, do you need a vaccination if you've already had COVID?
Yeah, that's a great question, and the answer is yes. You do need a vaccination, and the reason is because people's immune response varies greatly, and we see a reliable response after vaccination. So we've seen this in Brazil and other places where people have gotten infected and they get a second round of infections. And so the answer is yes. And there's also been questions about the timing of that immunization. And the question is, after you're no longer feeling ill and you're no longer isolated, then you're eligible and should receive the vaccination.
Right.
There are some caveats given the shortage of vaccination about that timing. But if you're asking that question from a purely patient-centered perspective, you should get that immunization as soon as possible.
Gotcha. All right. Well, that is it for the questions. And it's pretty clear to me that we could have actually turned this forum into a multi-hour webinar just based on the content you've provided and the Q&A. So clearly, hats off to Regents and the panelists for picking the right topic at the right time. Very, very relevant. So let me just say thank you, Angela, Dr. Grabowski, Dr. Polo, Scott Kelly. I want to thank all of you, of course, for being our panelists today. But we also have Cow Creek, our season sponsor here, and I want to thank all of your organizations for all the work that you've been doing throughout this pandemic. Thank you doesn't seem like enough, but what a heavy what a heavy lift. And we genuinely appreciate everything that you're doing for our community. So thanks for being here today, but thanks for all that as well. I want to say thank you to all of our other sponsors. Scott acknowledged them at the beginning of the program. But if you look back at Angela's photo from 1 year ago at this time, there were about 300 of us in a room together enjoying each other's company. And of course, great information as always. And let's just all keep our fingers crossed that these vaccines will in fact get us back together in rooms like that and in events that we all enjoy, and maybe even convening once again over an iced tea or a cup of coffee face to face. We're all looking forward to that. I'm encouraged by Dr. Polo's optimism for the way this thing is going to unfold. I also want to say thank you. I was reading a recent article from NPR talking about the ultimate responsibility for distribution and fairness, how that really is falling upon state and local governments. And as it relates to our local government, I want to say thank you and congratulations to Jackson County and of course all the partners who provided our area with a successful vaccination event at the expo. So good job and thank you. And I suspect we'll see some more of those large scale events like that. I've mentioned this before when I've wrapped up forum, but here we are turning the corner on 101 years of providing forum. If you read in the Mail Tribune the kind of a moment in history column, you'll see that often those are sprinkled with stories about forum topics literally from that day 100 or 101 years ago. And it would be interesting. I don't think I'll be around, but it'd be interesting to see 100 years from now how people react to the information from this forum and what they learned and their observations about what we're all living through these days. So again, thank you. I really do look forward to getting us all back together face to face. So thanks for being here. The last thing I'll leave you with is I really want to encourage you to participate and join us for next month's forum, which will be on Monday, March 8th, and it's sponsored by Hunter Communications. You're not going to want to miss this one. It will be, when I say it'll be full of international espionage and intrigue and cybersecurity issues, I'm not kidding. So I'm not going to tell you any more than that. You're just going to have to tune in and find out. So thank you again so much for supporting this program, for supporting the Chamber, to all of our panelists. And I hope you have a great Monday and a great week. Thank you very much.